Doctor, just talk to me about kind of where we are right now with cases in Ohio. I know they're going up, but
Yeah. So, interestingly, I was just looking at the dashboard, and if you look over the 21-day trend, we were only 590 cases 21 days ago, and we're up to 1261 today. So, 2.5 times, increased. I think, the good news is that hospitalizations and ICU admissions are pretty flat. And I think the thing that we're seeing, of course, as you know, is about a 15-year drop in the median age of patients. And those who are hospitalized are having shorter, hospital stays. So our health system, university hospitals with our, 12 medical centers is still somewhere between the 50 to 70 patients total COVID across the health system. So our peak was about 110, and it's still a manageable number. So very different. I think it's very important for your listeners, very different than Florida, Arizona, and Texas, where they're running out of ICU beds. Hospital beds are being, severely challenged. So there's still capacity here.
are you concerned though that we could get up to that point? I mean, if we don't do something, if we don't change something, if people aren't taking this seriously?
Well, I think, fortunately, we're very lucky in Ohio to have Governor DeWine and formerly, Dr. Amy Acton, who were very, transparent with us. They knew what they knew. They always admitted when they weren't, certain about some things, but they were able to impress upon the citizens of Ohio when physical distancing was necessary. We were great. Cell phone data show that we distanced over 60% compared to expectations of only 20%. I think the governor's, color coding system that has Columbus and Cleveland and Cincinnati and Dayton on, definite, masking being required. I don't see the same behaviors as when you turn on the TV and you see these, boats pulled up and everybody's aggregating together in Florida and in Arizona, and there's no distancing, there's no masking. So I think that, that could happen, but I think that it's better here. And I think that people take it more seriously because they saw that we were able to control what could have been, much worse. So I'm hopeful that people will continue to listen, to our political leaders, the mayor, the county commissioner, and the governor.
I know you did have plans in place earlier when you were concerned about the possibility of hospitals getting overrun. Do you still have those plans in place? We hope we don't have to use it, but if we do get to that point.
Yeah, so our HICS command structure, our hospital incident command structure is still in place. We still have, daily meetings at 7 a.m. and 6 p.m. Our surge plans for up to a 300% increase in beds from 1,700 beds across the health system all the way up to 5,100 is still in place. I'm the president of the Academic Medical Center, Cleveland Medical Center, our 1,000-bed hospital, and we have the ability to increase our ICU bed number from 120 to over 360 with the surge plan. So those plans are there. They're shelf ready. We can pull them right off the shelf and surge away if we need to, but we're really hopeful that we won't need to do that.
So I live in the flats. I'm sure you're probably familiar.
Yes.
And just kind of walking around, how the bars are kind of all open and you can see the people. I mean, I've seen some places where it's packed. I mean, they're obviously not following the governor's restrictions. Does that concern you when you see stuff like that we could potentially have a surge, or like if we keep seeing that, could that lead to another shutdown?
Well, it is very concerning. And I think that if you read the recent recommendations from the mayor, he said that if 50% occupancy was not adhered to, and if there was not masking, that they would fine these establishments, twice, and then potentially shut them down. And I think that it is very serious. And I think that compliance is very important. There's no question. We have example after example. Probably the most notable one was when this individual in Seoul went to 3 to 4 bars on Friday and Saturday night in South Korea and exposed 2,200 people, and over 200 then tested positive. So there's no question that this type of activity is very, very high risk, and is one of the reasons, as you know, people have said that these get-togethers with many people without distancing is very risky. And I agree with you. And I would say to you, walking past those bars in the flats, I would stay away from them if I were you.
Trust me, I'm not going in there. I'm too scared from covering all this stuff.
Yeah.
So we are seeing some states, though, shut everything down again. Of course, you mentioned we're not at that point, but I mean, is another shutdown out of the question?
Well, I think that's something that Governor DeWine and his team is going to weigh very carefully. I mean, he has certainly, given us the levels, and I guess Cuyahoga County was purple for a while, suggesting that there was great concern. I think that the governor has shown he was one of the first governors, to shut us down after our 3 cases at university hospitals on March 9th. That he was very serious about this, and I think it could happen again. I hope it does not, because obviously there are risks to the economy. I wish that what would happen, and I know you know the data as well as anyone. We're going to have about 175 to 180,000 deaths from COVID by October 1st. If we have masking adherence and compliance, that number could be reduced by 25 to 30,000. I mean, to me, that's motivation right there. And, the concern is certainly that, yes, these individuals are younger. They do not have comorbid conditions. They are less likely to have severe infection. However, they all have parents and grandparents. And the problem is these younger aged individuals without risk factors go and visit those who are higher risk. And that's where the problem comes up. And again, the best story is the birthday party in Texas, where an 18-year-old goes to the birthday party. There were 18 members of the family. They all developed COVID. Grandma and grandpa ended up in the intensive care unit, grandfather on a ventilator, and the father of this individual also hospitalized. So, that's a very sobering story. And it tells you that innocent activities of just going to a birthday party can turn into a disaster. And so that's why, even distancing with your own family in the backyard, wearing masks if you have high-risk individuals is the prudent thing to do.
So I know you mentioned cases are up, but hospitalizations have been steady. And also we know that most of the people, or majority of the people getting COVID now, are younger compared to what we saw earlier this year. But I also know that those hospitalizations can sometimes be weeks behind these cases going up. So are you concerned at all that we might see an increase in hospitalizations down the line?
Yes, I think that's a great observation. So as you know, when you're exposed to someone with COVID, it's typically 3 to 5 days before you develop symptoms. And in this pre-symptomatic stage, you could be a source of spreading the virus. So if it's 3 to 5 days alone to become positive, and then as we know, the duration of symptoms, we say that from the standpoint of being able to spread infection, by 10 days after the onset of symptoms, you're okay. So that's a period right there of 2 weeks. So you're absolutely right. Both hospitalizations, ICU admissions, and deaths lag, these big exposures. So it'll be very interesting to see what happens here now. I think the only thing that we can hope for, as we've said, is that this drop in the age of about 15 years is giving us a group that is less likely to be hospitalized. And if they are hospitalized, they have shorter hospitalizations. However, when they expose their parents and grandparents, that's where the trouble could become. So I think you're absolutely right. Florida had an increase in number of cases for 2 weeks, and people said, well, there's no change in hospitalization and deaths. And now, of course, 40 hospitals on the east coast of Florida have no ICU capability, and the hospitals are almost at 100% occupancy. So I think the next 2 weeks will be very important.
Yeah, that's what scares me, because it kind of seems like everything's fine, and then out of nowhere, that's kind of what we've seen, at least in places like New York and Florida.
Exactly.
I'm almost done. What was I just going to ask you? And what do you think, just in your opinion, what is the reason now that we're seeing younger people affected this time around?
Well, I think, listen, I have 3 boys, 25, 22, and 19. And they distance when they could, and now the weather's warm and they want to get out with their friends. And so they're a little bit riskier in terms of going out. And I think that that's what we're seeing. You're going in the flats and you're seeing people at bars, and it's summertime and they see the boats there. And so the masks come off, they're in the bars, they're kind of 6 feet apart, but then they're 3 feet apart. And so, there are problems. So I think that's the issue, which is that the younger people feel less vulnerable and willing to take a little bit higher risk. And I think that's really been the reason why we've seen the shift down of about 15 years on the median age of those infected.
And how many, you mentioned earlier, how many COVID patients did you say you had at your hospitals right now?
It fluctuates between about 50 and 70.
And how are your hospitals doing otherwise? I know you had seen a decrease in ER visits. Are people getting more comfortable with coming back in for emergency?
Yes, that's great. We've been, putting a lot of focus on taking care of your medical problems, creating a safe environment for patients to come back. And our daily emergency room visits now are not quite back to pre-COVID, but have doubled since their nadir. So we were as low as 400 to 500 a day, and now we're up to over 1,200. So I think that people are feeling better. There's still a lag, though. For all the parents out there, vaccination rates in children's schedules are behind. They've been delayed. There was a recent study out of Michigan, somewhere between 25 to 49% adherence to vaccine schedules. And we say it's really important to get your kids back to the pediatrician. It's very safe to do that. And it's a big warning, obviously, for all of our population, which is, guess what's coming around the corner? Flu season. Mm-hmm. And it's very important, since the symptoms are the same: fever, cough, body aches, myalgias, etc., that we stay on our flu vaccine schedules that'll start at the end of September. So, we don't know yet about the severity of the flu season quite yet. We'll have to look to Australia and other countries that really get it first. But, we're saying adherence to the flu vaccine, very important, because similar symptoms, the hospitals are going to get crowded from flu. Please, it's very safe. Get your flu vaccine.
Just one last question, Doctor.
Sure.
Just overall, how concerned are you right now for Ohio? Are you worried that we could see some of those numbers down the line, like some other states are seeing right now? And if you are, what is key to making sure we don't get to that point?
Well, I think, what's key is following the governor and the director of ODH, and making sure that, that we are masking, distancing, and using good common sense related to hand hygiene, and good cleaning recommendations, in your house and in your family. What would I say? I like to use sort of the red light, yellow light. There's no question that we have flashing yellow lights in Ohio. I mean, cases are up 521 days ago to over 12 to 1,300 a day. So we have flashing yellow lights. Hospitalizations and ICUs are flat right now. What's the rest of the country? Well, Florida, Texas, Arizona, flashing red lights. I'd much rather be here. We know that our close neighbor, Pittsburgh, is having a big, Allegheny County, a big increase in cases there, hospitals filling up, and they're trying to figure out why, because they really contained it initially. So there's some question, was this related to 4th of July celebrations and people, not doing a good job distancing? So we have to stay on it, follow the mayor, follow County Commissioner Budish, follow the governor, and, use good common sense, keep your family safe, mask, distance, hand hygiene, and we're going to get through it.
Thank you so much. Is there anything I missed that you would like to say?
Well, I think, listen, as everybody asks me, when's it going to be over? And a vaccine. So, we're very hopeful the Oxford Jenner Institute AstraZeneca vaccine program will report out their major results in August. They've contracted for over 2 billion doses with a variety of manufacturers across the world. The U.S. has apparently contracted for up to 300 million. I am so hopeful that we can have a vaccine on the October, Q4 timeframe in this country, and we can give it to, first responders, frontline healthcare workers, those in high-risk groups, the elderly, heart disease, lung disease, pregnancy, immunosuppression, cancer treatment, and let's get this going. And ultimately, our way out of this is a vaccine.
Fingers crossed.
Yes.
I just wanted to ask you one more thing I was just curious about.
Sure.
Obviously, you said younger people typically, they're not as at high of a risk as older people and people with pre-existing conditions, but we still are seeing some younger people die from this virus.
Yes.
And I'm sure you've seen the headlines about the coronavirus parties. I think a 30-year-old in Texas just died. How does
Yes.
that make you feel when you see that?
Well, I think that, look, there are a lot of misconceptions about coronavirus and the risk factors, obesity now, a BMI of 30, which is not uncommon in Ohio, is a risk factor. We also know, and we don't know exactly why, but if you look at who's affected by COVID, African Americans have a threefold higher rate of COVID than Caucasians. Hispanics are in the middle, about a twofold increased risk. And it's not just comorbid conditions. It's not just higher prevalence of obesity, diabetes, high blood pressure, heart disease. And so we don't understand that. So, it's a very difficult scenario. I think it's a big mistake, a very big mistake for a young person to say, if I get COVID, it's not going to be a problem for me. We know that there are, exactly as you point out. We saw in the news last week, an 11-year-old passed away from COVID, this very prominent case of a COVID party of a 30-year-old. And we have a lot of young people who unfortunately have BMIs of 30, and they're at risk for severe illness from COVID. And I have to say, if you've seen people who've had COVID, loss of taste and smell for 2 to 3 months, a cough with potentially fibrosis in the lung from the pneumonia, it's not easy to get over it. People have COVID brain, they're calling it, where it takes time for the encephalopathy of COVID, the mental status changes, the behavior, your personality to completely come back to normal. So it's not benign, even if you get over it. And so I urge young people, please mask and distance if you can.